was much preparation going on for this oversight visit, but there were also surprise visits to some of the institutions.
Yes, Sakina, when we crossed to you yesterday, you would remember that we had the MEC of Health, Ndiswa Gomba, going to do an oversight visit, a surprise visit to the Livingston Hospital, where the parking lot has been converted into a COVID-19 ward. What was interesting that came out of that interaction with her was that she was saying that although we've got enough nurses, there just are not enough doctors. She said that there's not a problem that started now during the pandemic, but something that dates back to years back in the Eastern Cape, that for a long time, there just aren't enough doctors, and the pandemic, if anything else, has brought that to light. But I think it's also important, Sakina, that our responsibility as journalists is not to also cause unnecessary harm, because if you go to social media, people are speaking about a second wave in the metro. And yesterday, the Minister of Health had a joint meeting with nurses in Johannesburg, and in that meeting he said that he cannot really say the Eastern Cape is currently going through a second wave, so really just trying to bring some calm and stability, saying that yes, the numbers in the metro in the Eastern Cape are rising, but it's not yet at a stage where he can say it's a second wave. He said that there are outbreaks in certain areas, hotspots have been identified, but to say that it's a second wave will really be incorrect. He said that if the issues of the outbreak in these certain areas is not contained, then perhaps the Eastern Cape will go to a second wave. But it's not fair to say that the Eastern Cape, especially the metro, is going through a second wave. So I think it's interesting to note that the Minister of Health is here, he is concerned, but is trying to make sure that we don't cause fear, but more try and teach and educate people to be cautious, to safeguard themselves about the spread of this virus.
Lerata, also today we know that those workers affiliated to Nahau will be embarking on strike action, and this amid the concerns that are currently being experienced in the Eastern Cape. What are the indications thus far about that situation on the ground?
That strike is definitely going on for a long time, Sakina. I think about 4 or 5 months back now, Nahau has been saying that the issue of shortage of staff in hospitals is a problem. They've been complaining that nurses and doctors are overworked, and they need to deploy more nurses and doctors to hospitals in the metro. So I am aware that that strike is going to proceed, because if you just go to social media or to speak to every single nurse or doctors, they are really exhausted. They are working long hours at a time. It was really scary. Yesterday, I actually spoke to a doctor at Livingston Hospital, and I was asking her, you know what, aren't you scared? And she said, you know what, I am scared, but I've got to fight. But the one thing she did complain about are the long hours, and she said, you know what, we need more and more doctors, people that have retired, to come back and put their hands together to try and fight this pandemic. So now, how, for one thing that I know about them, they've been complaining for a long time, is the working conditions in hospitals, the lack of nurses, the lack of doctors, and saying that they need to deploy more, because the more hands we have to fight the pandemic, the better it will be. But Sakina, the MEC of Health, Ndiswa Gomba, has arrived. Let's just quickly speak to her before I go back to you. Good morning, MEC. Yesterday you spoke about the issue of insufficient doctors, especially in COVID-19 wards, and you said this is an issue that dates back even before the pandemic. You also talked about an organogram that you're going to beginning to embark on to try and make sure we have enough doctors. How bad is the challenge of insufficient doctors? Where are the problem areas, especially in the hospitals or in the Eastern Cape? And what plan in the organogram have you put in place to try and deal with this issue?
Thank you very much. Good morning, viewers. The issue for me is a long-standing issue. However, it has been compounded by the pandemic. The pandemic itself exposed the shortages in a dire way. So what then happened is, even before the pandemic, when I joined the department, I found it difficult to mitigate the COE that's very high and the constant cry that there's shortages of staff in the department. Hence, I engaged unions for us to look at the structure. One of the missed issues and opportunities is that when you deal with a structure, you are dealing with functional structure, but equally work measurement. This is not what we are doing in government. And for as long as we don't do it that way, we'll always have shortages of staff, or to a certain extent have additional staff that is not able to be needed in those facilities, which becomes very difficult. If you employ a person for a particular hospital, and when you have got shortages in another hospital, people easily move. These are some of the issues. As an example, we're having here in Nelson Mandela one hospital, which is the provincial, which is not doing work on COVID, but has got doctors that are, to a certain extent, not as challenged as the ones in Livingstone. And then what we did was to talk to them to say it is high time that some of them move to Livingstone so that they add on the doctors in Livingstone. That's one way of how we are doing things. We're lucky at this time. We've got doctors that have come on board, Doctors Without Borders. They've come on board, of course. Our brigade, in terms of the Cuban doctors, we're drawing some from where we do not need more to Port Elizabeth. That does not suggest that we have got enough until we have a proper analysis of shortages of staff.
MEC, this time the Minister of Health has come with the intergovernmental team to deal with the matter. He has brought Minister of Social Development and also Minister of Traditional Corporate Governance. How important is this collaboration? Because this is not a health issue only, it's a family, it's a social development issue. How important is the collaboration between all the different government structures, and also what will you be doing now, especially on the ground, to try and fight this virus?
The importance of the collaboration is twofold. One, on the understanding of what is expected from each of us as department. In particular, as we deal with COVID, you will find that health might be expected to be the ones that are pumping the budget which they don't have, that are pumping staff which they don't have, which are blamed for a series of issues that are not necessarily in our power. If you look at queues in post offices, it needs a social development person to deal with those queues. We can't take the overstretched staff from our own facilities and actually put them in queues, in post office queues, precisely because we need them back in our facilities. They are tired, they are overworked. It's correct to say they really feel the strain. Remember, we never rested since COVID. There was nothing like saying there's no COVID, so we can take leave. So the very same surge comes back with the same people that we have. And we're now saying this is one of the issues that were hardest hit by the AG, that we did make a requisition of a number to employ, hence our contract workers. But now it does appear that we need more.
Well, that is the MEC of Health, Sindiswa Gompa, really stressing that there's an urgent need for more doctors in the metro, saying that's an issue that goes back even before COVID-19, but saying that she's excited by the Minister of Health's visit together with the Minister of Traditional and Corporate Governance, that this is going to make a difference because a collaborative effort is what is needed to fight this pandemic. For now, let's go back to you in studio.
Thank you so much. Our reporter Lerato Fekisi covering that story for us in the Eastern Cape. And of course, SABC will bring you that crossing live once the Minister of Health and the inter-ministerial task team give their observations and of course also outline their plan for the Eastern Cape. So do stay with SABC News.